They say you never really know what you have until it's gone. And as we look at what we have gone through this past year, we can say we've lost a lot. Life, love, freedoms, and our reality. We can say life often takes the harshest of reminders to help us refocus on what really matters, each other. The thing that we walk past, look through, and sometimes ignore. Our life offers us so much promise for tomorrow. Through courage and compassion for this life, we can make a difference. Together, we can make it to the finish line. Together, we can be strong and unbreakable. Together, we can fight through the tragedy, the fear, the misinformation, and the disruption in our lives. We've gone this far. We are this close. We are at the beginning of the end. We can end this pandemic. We can save lives, but we can only do this if we act together. As it turns out, making the decision to receive the vaccine to save your own life just might save humanity as well. Because that's why we're here. As the saying goes, I'm not here for me, I'm here for we, and we are here for them.
My name is Julie McElrath. I'm a physician and I'm a scientist. And here at Fred Hutch, I lead the Vaccine and Infectious Disease Division. So you can see we've been pretty busy. Our work here has gone on for over 30 years. And we've worked with other viruses, HIV in particular. And of course, when COVID-19 hit early last year, then we put a substantial effort into the COVID-19 work to try to understand a little bit more about how the virus infects people and what type of immune response would be needed to control that virus or to actually prevent getting infected. And some viruses are RNA viruses and some are DNA viruses. So in the case of the SARS-CoV-2, this is an RNA virus and it has one strand. It's a positive strand RNA virus. And of those types is a pretty big one. It's about 32 kilodaltons in size. And the shape of it is, I think everyone should know what the shape of it is. It's sort of a rounded type virus and has these spikes on it. And so those spikes are very important because that's what our vaccines that are here are instructing our immune cells and the cells that the virus infects to make more copies of. It only instructs it to make an antibody against the spike protein. So usually vaccines are an activated form of the vaccine, of the virus itself. Or they could be live, but they're not really replicating very much or growing very much. Those are types that we've seen like with measles vaccines, smallpox vaccines, that's what those are like. And then more commonly now, the types of vaccines that we have are just proteins. So have nothing in those vaccines that could cause the whole virus to be given with a vaccination. And so it's just the protein itself. And so you make a vaccine to have something about the virus shown to the immune system. In this case, with the SARS-CoV-2, we're showing the spike protein, okay? And it can be shown in lots of different ways. It can be shown as in a messenger RNA with the Moderna vaccine and the Pfizer vaccine. It can be shown as sort of a part of the sort of luggage of another type of virus that's been relatively inactivated. Or it can just be the protein itself. So there are lots of ways that you can present that antigen, is what we call it, the antigen from the virus that we want to make antibodies to. And so we give the vaccine and we look to see if those antibodies are made. And we look to see, what's the level of those antibodies, the concentration that we can measure in blood, and also whether or not they have a function against the virus. And that function that we're really looking for is to see if it can prevent the virus from growing, okay, from entering the cells and growing. So that we have antibodies and we have T cells. And both of those are important to elicit with a vaccine. And we know that this is what's happening with the vaccines that we're testing thus far. So the messenger RNA type vaccine is a relatively new platform. It has been used in influenza and some other types of viral infections, and then also potentially as a cancer type vaccine for different cancers. But in this case, it's being used as one of the ways to express that viral antigen, the spike antigen, that we're interested in getting immunity to. So the way it does it, we all have messenger RNA in our cells, and basically the messenger RNA is there to help translate the code into proteins, okay? So they're there, they're very busy. And so what we have now is more like a synthetic RNA, which goes into the cell after being vaccinated, and then it can start instructing the machinery to make the protein. In this case, that would be the antibody that would recognize the virus, and in particular, the spike protein of the virus. Some of the vaccines that will become available, we hope soon, are ones that we are more familiar with, the platforms that are being used. As I say, the messenger RNA is a new platform, although it has been in people, and thousands of people, and has been used safely, and they have been effective. But it is a new kind, and the real benefit of this platform, as you can see, they're the ones that were the first out the door, is that you can make vaccines with the messenger RNA platform very quickly, okay? And so that has a real advantage to, once you discover an organism that's causing a pandemic, as we did, and this was, the sequence and the virus was identified last January, and you could understand what to go for in order to get the messenger RNA to make, to instruct. And so once you know that, then these can be produced very quickly, okay? And then they can get into people very quickly. So if you think about it, these vaccines were made as soon as they knew what the sequence of the SARS-CoV-2 was in January, and it was for the first time into people in March. Okay, so it was a very short timeline to go from discovering the virus to actually being able to make a vaccine for it. In the case of SARS-CoV-2, I think we lucked out in that way, that we could figure out fairly quickly what the virus was, what its sequence was, what was the antigen that we needed to tackle. And all of that has really been learned because of the previous work that has been done with other viruses, including other coronaviruses. That's how we learn. So we were really, in some ways, prepared in order to be able to figure this out, to get the vaccine made, and then to get it out to people. Yeah, so, all vaccines have some side effects. We're all pretty familiar with them. If we've taken other types of vaccines, we can feel bad for a day or two after having them. And that's really not too uncommon, okay? There are these really rare types of events and side effects, and those can also occur with most vaccines. Some of these ones that seem to bring a lot of fear in people, like the Guillain-Barré or these neurological ones, those are usually ones that we've seen in just a very rare numbers, like 1 in a million or something. We're not expecting to see those here. That would not be something I would be afraid about with these vaccines. In this case, the safety record with both the Moderna and the Pfizer vaccine actually it looks good, and you can potentially expect to feel kind of sick for a day or two, kind of like a flu-like illness. I think that's the worst that we would see, and then you'll get better. So it's a short-term effect. Well, we know that we're looking, okay, in the clinical trials of individuals who've gotten these vaccines. We're continuing those studies, hopefully out to about 2 years, and we'll be able to tell that. It looks like that, coming up to those vaccines were given in the large phase 3 studies toward the end of July. And so as you can see, we're coming to about the 6-month stretch on that. So the data we have is to that period of time. And it looks like they are lasting. The titers are staying up. And so we anticipate that they will still stay up, and that not only are the antibody levels, present and there, we know that there are the cells that make those antibodies. They're called memory B cells. These memory B cells can still come back as needed to remind our immune system, yes, we've seen that before, and then they can just turn out new antibodies. So it should last, and that's one of the things that we're trying to understand of what is actually even happening in the natural infection, is how long will those antibodies last. So, right now, as you know, the virus has been around since, in the United States since, mid to late January, as far as we know. And so we have not quite that much data now. But what we want to know is how long will they last over years, period of time, those antibodies, that immune response. And that's something that we're studying now. Not everyone has been tested for COVID, but some people think that even if they haven't had a test, that they may have had it, and that's possible. Or they may not have even known they had it, because when they did get it, they had no symptoms. We recognize that that's going to occur. As far as we can tell, it's safe to give the vaccine to people who have had COVID-19, as long as you're not really in that active phase of the infection. If you're sort of past that and you've recovered, then it is worth getting the vaccine, and we would recommend that you take it. Okay. We don't know if the level of antibodies you have will be sufficient to protect. They may be, but by getting the vaccine, we think that we can enhance that antibody response, and that should hold you over for a longer period of time. And so that we'll be looking for that, but that's our thought, that it's going to be good to have just that extra boost with the vaccine that could allow you to potentially see it better the next time around. So the clinical trials for the vaccines right now are primarily looking as can it prevent COVID-19, the disease, okay? And we've seen so far that looks to be the case at really remarkably high levels, okay? You just don't really get any better. It would be rare to get better than 94, 95%. And there are other studies that are being planned to actually look to see if you take a vaccine for SARS-CoV-2, can that actually prevent spread to contacts? And so those studies will be starting, we hope, early in 2021 to look at that. That's going to be really important. We hope that those vaccines will have that effect to eventually, if enough people are taking the vaccines, to actually prevent spread among close contacts. You know, I think that it's been a hard year for everyone. And I think we all want this to be over, this pandemic. We don't want more deaths. We don't want people to feel as sick as they have felt with COVID-19, and that sickness can go on for a while. It's time to end it. We need to get back to our normal lives. We need to get more happiness, and we deserve it, let's say, because we've all been good in trying to really prevent its spread. The best way to eradicate this problem, this disease, is with preventing that infection, and that is with a good vaccine. And so vaccination is what has been the tried and true remedy against infections and infectious diseases for centuries now. And so this is no different. You know, we need a vaccine to make COVID go away, and we need everyone to take it. And the more people who take it, then the sooner we will be able to say goodbye to COVID-19. Right now, I think that the safest thing to do is to take the vaccine that is available to you now to take. And as soon as one is available for you, then take that one, okay? Don't wait. You know, it's not gonna really do you any good to wait. The important thing is the antigen of the viral antigen that we're trying to make antibodies to. Every single one of these vaccines are doing that, okay? That's what they're all going for. They're just presenting it a different way. And so there's no reason to wait, okay? The real important thing is to just try to take it when you're called to take it. And let's see if we can get an end to this.
My name is Julie Zartosky. I'm a nurse practitioner with the Fred Hutch Cancer Research Center. So I'm here in a trailer in Federal Way where we're enrolling people in the community to participate in one of the vaccine trials, where we're looking to see if there'll be another vaccine that would work against COVID. So since the beginning of the pandemic, I've been working with the Fred Hutch and following a group of people who got COVID. And so we have a group of over 170 folks that have tested positive for COVID, and we meet up with them early in infection, draw their blood, and follow them over time to see what's happening in their immune system, what is there immunity, how long it might last, and we follow folks over time. We also look at symptoms that folks are having over time. So if you, a lot of folks get COVID and they get it for a couple days and they're fine and they're gone. But a good percentage of people get COVID, may be mildly sick for a few days, and then they just don't get better. And by not getting better, meaning not feeling 100%. So maybe you still have some fatigue, you have to come home and take a nap. Maybe you have a new arrhythmia that's formed. Maybe your heart rate just goes really fast when you exercise. Maybe you have joint pain. Maybe your hands or your feet fall asleep really easily, something called neuropathy. Maybe you're not thinking very clearly, you get brain fog, swollen joints, and these kind of symptoms can linger. We have people in our study who've had them for up to 9 months. And so really looking at why some folks have symptoms that last longer than others, and is there anything different happening in the immune system in those people? So even though I just got vaccinated, I'm still going to be wearing a mask. And when I'm with patients, my eye shield, and if they have COVID, even more, the gowns. And the reason for that is because we need to have time for everybody to get vaccinated. Not everyone's going to have the same reaction to the vaccine. And so maybe not everybody's going to be immune. So we want to give time to make sure we can all get vaccinated and develop an immunity. And so we still want to be protected. And, you know, ever since COVID started, I've been wearing PPE. I've been with a lot of COVID positive folks, and I haven't gotten it yet. And I really think it's because I'm so diligent about wearing my mask every time. When we looked at some groups of first responders that had had a higher exposure to folks with COVID in the beginning, we saw really low levels of infection in those folks. And so I really think that PPE is important and that it works. You know, we don't know yet, is the vaccine just keeping us from getting sick, or is it keeping us from carrying the virus and bringing it home? But that's why I'm still really careful at work. I'm still gonna, until we have all those answers, I'm gonna know, okay, I'm not gonna get the disease because I got the vaccine, or my chances are really low now. And I'm not going to get the virus on me because I'm gonna keep using my PPE. So I think we still have to do PPE and vaccine until we have all these questions answered. So once we get vaccinated, when are we going to be immune? That's the question we all want to know, and we're still trying to figure that out. I think some early data is showing us that there might be some level of immunity after close to about 2 weeks after the first shot, but that's not guaranteed in everybody. And so really, I think we're looking at a couple weeks after the second shot, perhaps. And another question I get asked a lot is, how long is immunity going to last? And we don't know. That's the bottom line. We don't know how long it's going to last. We have seen people now, 9 months out from COVID infection, and we're not seeing a lot of reinfections in our community. So, immunity may last for a bit, but in terms of immunity to the vaccine, we're not sure. And so that's something that we're going to have to look at as the research continues. We have quite a large group of people that are out 9 months from infection, a number of firefighters and first responders that we enrolled early in the study, and they still have loss of taste, loss of smell. If their taste has come back, sometimes their favorite food now tastes awful. They'll have phantom smells where they'll smell something burning, maybe not the best thing for a firefighter, but odd smells like salt water. And, you can also have joint pain, arrhythmias, fatigue, brain fog, all this stuff continuing on months and months and months out from infection. So if you've already had COVID, why would you need a vaccine? That's a really good question, and one that I get a lot. And when we look at people who've had COVID and we look in their immune system, we do see that most people have had an immune response. And when we look around in our community, we're not seeing a lot of reinfection in people who've had COVID. So we know there's some level of immunity, but we don't know how long it's going to last. We don't know how complete it is. And some people with COVID wonder if the immunity they have from COVID is better than the immunity from the vaccine. It might be, we don't know. But once again, we don't know how long it lasts, and it's not going to hurt to get the vaccine on top of it and boost that immunity. And that's something that we're looking at in this study is folks that were in our study before that had COVID, they get the vaccine. We're asking them if they'd be willing to come back so we can look and see what exactly the vaccine is doing in folks after they've had COVID. And so I'm always telling people, if you've had COVID before, when it's your turn to get the vaccine, go ahead and get it. It's not going to hurt you, and there's a really good chance it's going to help. This video, as I know, is going out to all the firefighters in the community, and I just want to say thank you. Getting to know everyone over the course of this study has meant a lot to me. So, there's a vaccine on the table. Take it, because, you put yourself out there for everybody, and here's a chance to be protected. It would just crush me to see people, it's fine if you get infected and you get well, but not everybody gets well after they get infected. And I just don't want to see people take that risk when you're already taking so much risk.
My name is Hector Lovano. I work for the Renton Regional Fire Authority, and I ride Engine 311 on C shift. I got vaccinated about 2 weeks ago now. Super easy experience, very simple. I got vaccinated as soon as I could because I've seen how challenging this year has been for so many people. I'm super grateful and fortunate to have this job and the security that it provides, but the reality is that for most Americans, that's not the case. I've seen that firsthand with my parents. They're small business owners, and they've been struggling to make ends meet, and I see it all over the place, all over the city, and it really breaks my heart. I know how hard my parents worked to build what they had, and to see that threatened by this virus has been really overwhelming.
Hello, my name is Brian Mayer. I'm the captain of Rescue 1 for the Seattle Fire Department. The reason why I got the vaccine is twofold. Number one, on a personal level, I'd like to see society be able to return back to some type of normalcy. I think that this is having a massive effect on children and families and people of businesses. So the faster that I personally and those around me can help this disease to come to an end, hopefully, I think the better off for society that's going to be.
Hi, I'm Garth Stroyan with the Seattle Fire Department. I'm on ladder 12 on D shift. And today I came to get my shot because I feel that it's important not only for my own health, but the health of my family around me and my friends and co-workers, not to pass this disease on to anybody else unnecessarily. I'm ready for society to open back up again, to go do the things we want to do, go eat lunch, go to a restaurant, go to a movie, go out and meet with friends. So the sooner we can do that, the better.
Hi, I'm Doug Locken. I'm a paramedic, medical services officer with the Shoreline Fire Department. I think it's important to get the vaccine. If you would have asked me a month ago, I would have said, no, I'm maybe not going to get it. I was one of the people that was wavering back and forth. I think the benefit really outweighs the risk in this situation. I've heard people compare this to the flu when it first came out. And initially that was a comparison we could all get on board with, but as you learn more about the disease, you realize it's not the flu, and people don't just get it and get over it. Some can, some can't. I've got a friend that just spent 50 days in the hospital, most of that in the intensive care with a tube in his throat. And he's actually just going home today for the first time in 50 days. So there's a lot of benefit to trying to turn the tide and getting this disease under control.
I've spoken to many people that have had COVID that say afterward they have some lung reactions that have lasted up to 6 months afterwards, where their cardiovascular systems and their lungs' ability to be able to support cardio function has been severely diminished. So as a leader and leading by example, I had to do that for my company and for the citizens that we serve.
And so the vaccines are here, as you all know. And I just found out early this morning that I am eligible to receive it. And so as soon as I can, I'm going to get this thing scheduled and get my first vaccine.
I think the reality is we need to get back to normal, but that's not going to happen until we get case numbers down, hospitalizations down, and ultimately deaths down. And I think for the sake of people like my parents, we need to make that happen. And this vaccine is a big missing part of that puzzle. And you know, every time I walk around the city and I see another closed down business, I think about my parents and I think about all the hard work that they put into it, and what it would mean for them if they closed down. So if you're on the fence, you know, consider people like my parents and your neighbors, and what they're going through, and you know, let's beat this thing.
If you tried to put a single face on it, it would be difficult, but I could put 1,000 faces on it because it's everybody that I see. I'm not so worried about catching it myself, but I'm worried about being a carrier and giving it to somebody that can't tolerate it, maybe as well as somebody that's healthy.
There are a lot of unknowns, unfortunately, with how the vaccine and you know, the people question how it was developed so quickly, and you know, the efficacy, and is it going to have long-term lasting effects and all that. But I think the benefit I see from the studies and from the CDC and the independent studies that have been done, just to me cemented in my mind that this is a good step to go. And yes, there may be some negative reactions in a very small percentage of people, but I think that the benefits, like you said, far outweigh the risks.
When I was weighing for myself, do I want to get this vaccine? Not only do I want to get this vaccine, but do I want to be one of the first people to get it? Because, you know, it's one thing to say get it after millions have gotten it. It's another thing to be in the front line, like, you know, we are in our work. And I really thought about it. I thought, you know, I am not going to roll the dice with COVID.